Yes, good morning, everyone, and warm greetings from Nairobi, Kenya. It's a pleasure for me to moderate this session of the Pharma Logistics Africa 2020, which is going to talk about the new opportunities for pharma supply chain improvements. My name is Sanjeev Gadia, and I'm the CEO of Astral Aviation. I would like to first of all thank the GRV Global Association for organizing this event. I was also in the event which took place in Nairobi 2019, which was the first Pharma Logistics Africa event, and it was a great event which was held at the Radisson Blu in Nairobi, and I'm truly honored to be given the opportunity of moderating a session on a very important topic, which is the pharma supply chain improvements. My organization, Astral Aviation, is a cargo airline. We've been operating in Kenya for the last 20 years. We've got a fleet of 14 cargo aircrafts, and we've played a very important part in the supply chain. Now, we're not the supply chain, but we are a part of the supply chain. And we've played a very important part in this supply chain by providing reliable and dependable air freight solutions for pharma products. In the last 20 years, we've participated in various projects in Africa, for the transportation of pharma and vaccines. Our planes have actually carried vaccines to almost 45 countries in Africa. And also, most uniquely, we've also been transporting a lot of vaccines into Yemen. The transportation of COVID medical items in 2020 brought a lot of challenges. We were very fortunate that our cargo aircrafts were able to transport the COVID medical items to 42 countries in Africa. So during the pandemic, while a lot of you might have been working from home, we were very busy working at the office. Our planes have been flying every day, and we've carried PPEs, medical items. We've been carrying ventilators and oxygen concentrators from all over the world to our hub in Nairobi. And from there, we've distributed it to between 40 to 45 countries in Africa. Coming to the COVID-19 vaccine, I think this is going to be the biggest challenge that we're going to face in the aviation industry. And because the supply chain and the aviation industry are all closely connected, what we believe is that we need collaboration between all members of the supply chain to make sure that we live up to the responsibility of transporting the COVID-19 vaccine to and within Africa. Because if you look at the statistics which we have received from Gavi, 20% of Africa's populations will receive its vaccines in 2021. And we have a collective responsibility to ensure that those vaccines are transported safely and in a manner in which the entire time that it takes to transport the vaccine is measurable and is implementable. So with this, I'm truly honored that today we have 4 experts in supply chain. And these are experts who are from Ghana, who are from Senegal, from Kenya, and also from the UK. So it's a great privilege for me to, first of all, introduce you to all my panelists. And I would like to first start with Dr. Maxwell Antwi, who is the country director for the Pharma Access Foundation, which is based out of Ghana. And then we are actually followed by Dr. Karishma Banga, who is a research fellow of the Overseas Development Institute, and she is live from London. And then we are actually now going to be joined by Dr. Clement Gombo, who is the Associate Director for the Global Health Supply Chain Initiative and is a member of the Association for Supply Chain Management. And Dr. Gombo is joining us live from Senegal. And last but not the least, we've got a fellow Kenyan, Dr. Judith Kariuki, who is the Associate Director for the Global Health Supply Chain Initiative and is a member of the Association for Supply Chain Management. So we are truly honored that we've got 4 excellent experts on supply chain. And what I would like to do is I would like to request Dr. Maxwell Antwi and the rest of my panelists to give us a short introduction of who they are and to tell us a little bit about what they're doing on the supply chain side. So with that, I would now like to request Dr. Maxwell for his opening statement.
Thank you, Chair, and warm regards from Accra, Ghana, which is the center of the earth. For those of you who are not aware, the equator and the Greenwich Mean Time meets in Accra. So my name is Maxwell Antwi. My background is actually medicine. So I am a specialist gynecologist who happen to have branched into supply chains and digital health platforms. Currently, for those of you who are aware, the World Health Organization has set up a new department called the Digital Health Department. And in that department, it's made up of a roster of experts on digital health. And I represent my organization on that platform. So I'm a member of the WHO roster of experts for digital health. We've been working with the Ministry of Health in many other countries aside Ghana on how we can use the power of digital technology to improve access to basic healthcare, and basically how we can connect more people to better healthcare. So in Kenya, I'm sure our Kenyan colleagues know about MTBA and what we are doing with Safaricom. In Nigeria, we work with Kwara State, Ogun State, Lagos State on digital access to insurance. In Ghana, we are working on medicine supply chain platforms, and in many other countries. So that's what we do as Pharma Access, and my role is to lead a team of an agile staff of Pharma Access working with partners to ensure that the systems that are required for a digital supply chain for medicines, not only medicines, but other pharmaceutical like consumables are also in place to facilitate access to better healthcare. So Chair, that's in summary, that's who Maxwell Entry is.
Thank you, Dr. Maxwell. And I would now like to request Dr. Karishma Banga to give us a small introduction. Thank you. Over to you, Dr. Karishma.
Thank you, Sanjeev. Hi, good morning, everyone. Thanks for joining us today. I'm Karishma Banga. I work as a research fellow at the International Economics Development Group at ODI. It's a think tank based in London. So primarily, I work on international trade, global value chains, and digital economy. So I'm working at the nexus of the three things, trying to understand how digitalization can be used as a driver for upgrading in global value chains and supply chains, particularly from the developing country side. And recently, we've been doing some work with the United Nations Economic Commission for Africa, looking at how COVID-19 has caused supply chain disruptions across different sectors. And one of the sectors that we look at is the pharma sector in Africa. And I hope to share some insights from that work with you today. And more broadly, I work on East Africa and in India. So I also hope to bring in some insights from what is happening in India and some lessons perhaps to be drawn from that aspect, particularly around digital technologies. Thank you.
Thank you, Dr. Karishma. And I would now like to request Dr. Clement Gombo, who is joining us from Senegal, to please give us his opening statement.
Thank you very much, Sanjay. Hi, everyone. My name is Clement Gombo. I'm very happy to join this panel today. And I really like the configuration of this panel. Now we have West Africa, we have East Africa. That means that we have all the Africa inside of this panel. That is very, very important. So as I said, I'm Clement Gombo. I'm a pharmacist by my background, and I'm working for the AACM, Association for Supply Chain Management, in the Global Health Initiative based in Senegal. So it's my pleasure today to be here in this panel with my colleague Judith, who will be presenting herself very shortly. So in Senegal, with AACM Global Health Supply Chain Initiative, we are trying to help countries, not just Senegal, but countries around, all the Francophone countries in West African region. We are trying to work with them in order to improve their supply chain. So basically, we are working with the Ministry of Health in those countries and all the different partners and donors who are working around. So we'll be sharing something that is very important, that is at the heart of what we are doing. It's about the model, supply chain in public system. What we are going to share during this panel and in this discussion. Thank you very much, Sanjay.
Thank you very much, Dr. Gombo. And last but not the least, I have a sister from Kenya, and she's not a doctor, by the way. Her name is Mrs. Judith Jumba Kariuki, who is also with the Association for Supply Chain Management, and she is now invited to please give us a few words of who she is and what does she do.
Thank you very much. Yeah, my name is Judith Kariuki, and I'm the Associate Director for the Global Health Supply Chain Initiative based in Nairobi, Kenya. My colleague Clement is based in Senegal. We also have another team in Nigeria. So what I do with the Global Health Supply Chain Initiative, I support the ACM's initiative in building sustainable supply chain professional capability in Kenya, but we do a lot of cross-learning and cross-learning, cross-pollination across the 3 target markets. My background is public health, so I'm a public health specialist, and I've had many years of experience in health programming, system strengthening, and capacity development. I have a very keen, special interest in health systems strengthening. So I'm very happy to be with you here in this panel and just to learn and to share what we do with the Global Health Supply Chain Initiative that is supported by the Association for Supply Chain Management. Thank you.
Thank you. Thank you very much, Dr. Kariuki. Sorry, Mrs. Kariuki, I beg your pardon. I don't know why I keep on calling you a doctor. I think perhaps because you look like one. So thank you, everyone. And I must say we're truly honored. We've got a fantastic panel today ahead of us. And now I would like to take us right into the questions and answers round. So I'll start with Dr. Maxwell Antwi, who's joining us from Ghana. And first of all, Dr. Maxwell, congratulations for holding a very peaceful election in Ghana. And this is something that we always wish that we will have in Kenya. And we're very happy with a very successful election which has taken place in Ghana. And on the side of the association, the Pharma Access Foundation, what I'm really keen on knowing, Dr. Maxwell, is that how is Pharma Access is meant for all? How is it leading the pharma supply chain innovation with Ghana's Ministry of Health and its partners? And what are the lessons that you have learned in Ghana, which you can be able to share with all of us?
Well, thank you, Chair, and thanks for the compliments on our elections. I'll convey it to our Ghanaian colleagues. So it looks like we've done quite well with our democracy. One of the areas where we haven't done too well is the management of the pharma industry in Ghana. So in 2016, Ghana was ranked by the European Union as the 6th country with the highest burden of fake medicines. So in 2016, the European Union developed a league table, can we put it that way, of countries with high burden of fake and substandard medicines. And we found ourselves in the unfortunate position of number 6. So in dialogue with partners and regulators, we started exploring how we could streamline the fragmented supply chain system, which is contributing to inefficiencies and challenges with medicines quality, and how we could address that going forward. We also did some landscape analysis that showed that the cost of medicines in Ghana was also very high. But the cost of penicillin in Ghana is 7 times that of the NHS in the UK. It was quite striking for a country which is not very well endowed financially to be paying 7 times for the cost of penicillin as our colleagues in the UK are paying for it. Recently, in the northern part of Ghana, the Food and Drugs Authority intercepted 1,500 vials of a medicine, which the doctors among us will recognize is called oxytocin, and is used to stop bleeding after delivery by a pregnant woman. So if you have 1,500 of the boxes of these that are fake and substandard, you can count the number of maternal deaths that can result from it. So there was a national consciousness that we must do something structurally about our supply chain system. So in partnership with the University of Ghana, we did a market study in Ghana to understand the procurement patterns, how our supply chains industry in Ghana playing out, who is buying what from where, what are the consumption patterns across industries, across regions, across different provider levels, and what are the key determinants that can go into an efficient supply chain system. So based on all the analysis provided by the academia, University of Ghana did a very good job to provide the scientific evidence and base for what we were to do. We then put together what we call a digital platform for medicines. And I really like to describe it very simply, because I remember when we were in Nairobi last year, one of the key takeaways was that Pharma Logistics Africa programs come up with very pragmatic and practical solutions that you can actually take home with. So basically what this platform does is to bring accredited, trusted medicines directly to hospitals and clinics and pharmacies. Basically, that's what it does. The landscape analysis that was done by the University of Ghana showed that there were 4 layers of middlemen from manufacturing to consumption within Ghana. And at each of these layers, there is the risk of introduction of fake or substandard medicine. In addition, at each of these steps, there was a marginal increase in prices of medicines of 10 to 15%. So if you have out of the 4 layers, you can understand why our medicines cost 7 times that of the NHS when it comes to antibiotics like penicillin. So what we did was to try and remove the many multiple layers within the system so that we can connect the trusted suppliers directly with hospitals, clinics, and pharmacists. Of course, one of the key learnings was financing. So we discussed with our financial partners so that we could bring financing to the suppliers so that they can also buy medicine, they can buy raw materials, they can do the importation, warehousing, and also bring financing to the healthcare providers so that they can pay for the supplies on time, so that you can remove the lag phase that we have with the financing. All this is digital. So the onboarding of the supplies, the ordering, the distribution, the tracking, the payments are all digital. And this was important so that you could deliver value to patients, value to suppliers, value to healthcare providers, and also to the Ministry of Health. So specifically for patients, the clear value is that you are quality assured of medicines you receive when you turn up in a hospital or a clinic or a pharmacy. And the WHO estimates that 1 out of 3 medicines on our shelves is either fake or substandard, which is quite an embarrassment. But if patients can guarantee that if they walk to a hospital or a clinic, then they are sure that what medicine they are giving could be quality assured. That's a great value. The other one is increased availability. Because of the fragmented supply chain system, there were huge stockouts at hospitals and clinics, intermittent supplies. And by making sure that the system is digitized and there's complete overview of who is handling what and where we have what, so that you can streamline and redistribute where there are challenges, we are able to assure that there's increased availability of medicines to patients who turn up. I think the greatest benefit to a patient is the lower prices of medicines. So by removing all these layers of middle, I call them middle people because they are not only men, they are also, so of all these middle layers, we're able to, right from the beginning, we're able to lower the cost of medicines on the platform averagely 20% below the market price. So just by connecting directly with trusted distributors and wholesalers, we're able to remove the inefficiencies in our pricing system for patients. For the healthcare provider, of course, that's good business. So there's less stockouts. And also the reduced cost of medicines means that your working capital requirements are less to serve the same number of patients. And also, every doctor, nurse, midwife, or pharmacist has something we call intrinsic credibility. You want to appear, and at the end of the day, when you walk out of your clinic, hospital, or pharmacy and you're going home, you want to assure yourself that you've done a good job and you've done a social good. So to be assured of yourself that the medicine you give to the old lady that walked out of your clinic was a quality assured medicine, it also brings you a lot of intrinsic value as well. And of course, what we started realizing is that patients began to vote with their feet. So hospitals and clinics whose medicines were trusted begin to see increase in patient visits. For the suppliers as well, I mean, the value they have been speaking to us about is that now they can predict demand. And once they can predict demand, they can then better manage their inventory, because inventory inefficiently handled is an expense cost to the supplier. So once they can predict demand and there's good inventory forecasting, then they can better use their working capital to make sure that they are able to meet the demand. And also timely payments. And so in Ghana, averagely payments can lag behind for like 9 months, sometimes even 12 months before suppliers get payments. On this platform, we are assuring that within 90 days, within 3 months, payments are made to suppliers after delivery. You know, so and also the marketing costs. And before this time, the suppliers have to then move from hospital to hospital marketing their products. But by being onboarded on this digital platform, suddenly you don't have to incur the administrative costs of marketing your products, because you're directly connected to your stream of consumers. So in summary, this is what Pharmaxis and the Ministry of Health, the Food and Drugs Authority, the National Health Insurance Authority. Let me say that this is a multi-sectorial collaboration to address a systemic challenge that we have with our medicines procurement in Ghana.
Thank you, Dr. Maxwell, for your presentation. And honestly, on behalf of all the citizens of Ghana, I would like to take the opportunity of thanking you and thanking the foundation for the excellent work that you're doing, and the fact that you've created a digital platform has actually improved the accessibility, has removed the whole issue of fake medicines. It's brought the suppliers and the consumers together, and above all, it's also brought down the cost of the high cost of medical items in Ghana, and I'm sure this is also the case in many countries in Africa. So what I will now do is I will now turn my attention to Dr. Karishma Banga from ODI. And I would like to ask Dr. Karishma about the new opportunities for digital technology and what can it offer to the African pharma value chains? And what are the lessons that can be learned from other countries, such as Ghana, for example, where we've had a wonderful observation or wonderful input from, and I just wanted to know from you, what are your views?
Yes, thank you. Thanks, Sanjeev. So I think as a starting point, it's also useful to understand where African countries position themselves in the broader, pharmaceutical global value chain. And on the one hand, you have, EU, Japan, and US being lead economies in terms of R&D of these medicines. And then you have India and China being major producers of active pharmaceutical ingredients or APIs. And majority of the African countries are net importers of these pharmaceutical and medicinal products. And some of the work that we've been doing with UNECA suggests that actually 95% of these pharmaceutical products are actually being imported. And it's also driven, the industry is driven primarily by a few countries, including Ghana, South Africa, Kenya, Nigeria. And most of the manufacturing that is occurring is more in terms of purchase of these finished products, which are then, packaged and repackaged to more consumer-facing industry. And what this has really done is that it has exposed the vulnerabilities in the sector to sort of interdependencies and reliance on global partners as the pandemic has struck. And as a result, there has been increased focus on now boosting, domestic production and capabilities within the sector. And I think here digital technologies, play a very, very important and crucial role. So, and this is true across the, across the supply chain, whether it is making data-driven decisions on the R&D and product development side, or using automation and robotics in the manufacturing of these pharmaceutical products. Or whether, as Maxwell mentioned, it is using digital platforms to increase market access to customers, or even remote monitoring of patients through digital technologies such as Internet of Things. And if you look at the vaccine system, which has now been developing, controlling temperatures remotely and monitoring those temperatures in the vaccine distribution system is also possible and more, doable now through these technologies. So I think, a whole range of opportunities exist to really leverage digitalization to increase efficiencies in the pharma supply chain. And I think here, some important lessons can also be drawn from India's experience, particularly around API manufacturing. So if you think about Cipla's API manufacturing plant in India, it's an excellent example of a firm which has fully embraced the power of digital technologies across its supply chain, including through automated material flows, digital management information system, and also the use of augmented reality and virtual reality for training the employees, on pharma manufacturing and maintaining plants. And I think so global estimates suggest that around 20 to 30% of productivity increases can actually be realized through investment in digitalization on the manufacturing side, because it can help in reducing manual errors, it can help to improve reducing variability, and also help improving quality of these drugs. And in addition to, I think, manufacturing, also investments on the R&D side, using digital technologies is also very key. So some of the evidence from India, for instance, suggests that firms that are investing in digital capabilities are exporting a lot more. So they're exporting on an average 45% of their sales, pharmaceutical sales. So I think investments in R&D, in manufacturing, can also play a very critical role in improving the export intensity of pharmaceutical manufacturing firms in Africa, which I think is also very key when we think about the African manufacturing plan, and can help African firms to actually develop their local domestic capabilities, not just in manufacturing, but also end-to-end, drug discovery and product development. So I think, yes, very useful and important opportunities to be realized now, particularly in terms of building resilience of the sector to future economic and health shocks.
Thank you, Dr. Karishma. And it was really great to get your insight on the use of digitalization and how you look at the Indian example and how we can actually be able to learn from that and apply it in Africa. So now I will turn my attention to Dr. Clement. And I noticed that Dr. Clement and both Mrs. Judith Kariuki are with the Association for Supply Chain Management, but they have one thing in common. Both of them are associate directors for the Global Health Supply Chain Initiative. And what I'd like to ask Dr. Clement is to give us some information. What is the Global Health Supply Chain Maturity Model? And can you please give us some insights about what value does it add to the public health supply chain? And what are the challenges that you go through?
Yeah, thank you very much. Thank you very much, Sanjay. So I'm going to interact your question with my colleague, Judith. First of all, for the first part of your question, I would suggest that my colleague Judith gives some answers to that question. And for the second one, on the value added and the challenges, I will come back and respond to that question. So Judith, over to you, please.
Okay, thank you very much, Clement. So just to situate the Global Health Supply Chain Maturity Model, I'll just give a little bit of background because the Global Health Supply Chain Initiative is actually run under the Association for Supply Chain Management, which is a global leader in supply chain organizational transformation, innovation, and leadership. So what ASCM does, it drives innovation in the industry with new products, services, and partnerships that enable companies to further optimize their supply chains, also to secure their competitive advantage and to positively influence their bottom lines. Having said that, the ASCM Health Supply Chain Initiative is actually a program that is funded by the Bill and Melinda Gates Foundation. And the main mandate here is to solve critical public health supply chain challenges, which include improving weak distribution systems, implementing reliable monitoring and data collection mechanisms, and elevating the maturity of local supply chain communities. So the goal of this initiative is to create self-reliant supply chain talent. That's the main thing. And to be able also to increase frontier market supply chain maturity and be able to therefore improve distribution systems. So with the teams that are based in Senegal, where Clement is, Kenya, and also in Nigeria, we provide technical support to the Ministries of Health and related government-owned public health agencies. So what So what the maturity model, so just to explain what the maturity model is, the maturity model is based on the premise that for you to achieve your overall supply chain excellence, you require many small steps of continuous process improvement. The Global Health Supply Chain Maturity Model provides you with a framework for organizing and prioritizing changes to a healthcare supply chain, okay? So the maturity model helps teams engaged in those improvements to plan and collaborate effectively, not alone, but also with other partner organizations in allocating resources and implementing sustainable changes. If you compare the model to other existing models, the maturity model is more of a self-assessment tool. And that means that the model can be quickly implemented by supply chain actors themselves to assess their own performance. Another key distinct characteristic is that it's a multi-level assessment tool. So you can use it at the community level, district, regional level, or even at the national level, just depending on the actor's desire. And you can use it to assess different supply chains, could be vaccines, family planning, essential medicines, or you can even use it to assess an integrated supply chain. So given that it's based on what we call the theory of constraints, it helps you to identify what are some of the constraints that prevent maximum performance of the supply chain. And not only the identification, but it also makes the constraints visible to facilitate an efficient allocation of resources to resolve those constraints, because that is what is making the supply chain weak, okay? What it also does, it also enables you to do an end-to-end supply chain assessment, looking at issues that are at a strategic level, tactical issues, as well as operational issues. So you get to have a holistic view of the level at which your supply chain maturity is at, what needs to be addressed, and what needs to be put in place for you to move to the next level of maturity. The model has 5 different levels. I'll just briefly mention them. It has a canvas level that runs from 20 to 39%, bronze level between 40, 59, silver 60 to 79, gold all the way to accredited. And each level is detailed in such a way that it has distinct characteristics that outline if you're at a certain level, let's say at canvas, what should we be looking for? What conditions do we need to observe? What are some of the key performance indicators? So it helps you to focus on what needs to improve in this level. Then it also has some key priorities, okay? For instance, when you're at canvas level, the priority is to make sure that basic capabilities are in place. And then it also helps you identify what are some of the investor implications. If I am at an investor at a certain level, what do I need to put in place? What should my resources focus on? And what do I need to do to identify improvement opportunities? So that's basically just an overview of what the Global Health Supply Chain Maturity Model is. And I'll invite my colleague Clement to just talk about the value it adds to the public health supply chain and some of the challenges that it responds to.
Yeah, thank you very much, Judith. So let me say first that the maturity model tool can be used both for private and public sector. But we as a team, as a global health supply chain team, we are just focusing our efforts on the public sector. So before going so far, let me summarize some public health supply chain challenges before saying on the maturity model value added. So when you look at the public health supply chain, you will find these common challenges that are, lack of comprehensive supply chain management data and performance measurement. You'll find challenges like inadequate technical capabilities of supply chain process owners. There is also challenges like inconsistent relationship, collaboration, and coordination of supply chain partners, and so on. So you'll find also in other countries a lack of government support to the public health supply chain. So what is the value added by the maturity model? We have 2 points there. The first one is the role that the maturity model is playing in the evidence-based investment and planning. And the second point is the role it plays in the performance management. So let me pause on the first role of the evidence-based investment and planning. So we know that one of the essential aspects to consider when accessing your supply chain is to be able to provide what I call the evidence of the investment made. We have to provide the evidence that all the investment we are making are based on the evidence. And this is important because we know that the resources are always limited, and therefore we must obtain a good cost benefit ratio. So therefore, the assessment using the maturity model provide a basis for investors to determine where to direct their resource in order to address what is already identified as a weak supply chain area, and also area that will result into great impact. That is the first value added. And the second one is about the performance management. So the other things is we need to monitor the performance of our supply chains. We are monitoring that, but by identifying what are the gaps, and we are just also finding the corrective action that can help us to close those gaps. So when the corrective action are implemented in a continuous improvement approach, we can then ensure that the ultimate goal of supply chains, which is to provide access and quality of and service for all, and that goal is achieved. And this means for our supply chain that we need a very robust assessment tool. And this is where the maturity model comes into play. And the assessment actually helps us to identify the baseline performance of our supply chain. It helps us also to track the improvement progress and evaluate the effectiveness of some corrective action taken. So maybe we can ask ourselves the question about what are the benefits, the practical benefits of the stakeholders that stakeholders indicated when using the maturity model. So just in few words, we say that the utilization of the tool has brought about coordination, collaboration, information sharing among stakeholders, and on where to direct resources and coordination of action. This is in very few words what I can say about the value added of the maturity model and the way we are using that value added to address some challenges in the public health sector. Thank you.
Thank you very much, Dr. Gombo, and thank you, Judith, for giving us some information about the maturity model. And it's also very interesting when you talk about the self-assessment tool. Now, I'd like to turn my focus on the COVID-19 pandemic, which is a big problem that we are facing right now. And one of the things that you might have heard is that WHO has actually created a vaccines readiness assessment tool, which they rolled out to 47 countries in Africa. And what has actually happened is that 40 countries have updated the tool and provided data to WHO. And what is shocking in this analysis is that instead of getting the desired benchmark of 80%, all the 40 countries which participated in the survey came up with a score of 33% readiness. So what it actually means right now is that we are in a very, very serious problem, because we've actually got a pandemic which has affected Africa in every aspect. But when you look at the readiness, only 33% readiness is what we have for a COVID-19 vaccine rollout. Now, it actually shows that for the people who are in the digital platform, what we've actually seen that only 17% of the members have data collection and monitoring tools which are ready. So what we are seeing is a very, very serious situation. And according to Dr. Moite, who actually mentions that we are very, very far away from a successful rollout. And what we really need to do is to actually make sure that we are prepared as a country, as a nation, to actually make sure that we can be able to roll out the COVID-19 vaccine so that it can actually now be used as a priority over the next 2 years. Because according to WHO, 60% of Africa's population needs to be vaccinated, and they've come up with an analysis that 1.5 billion doses of vaccine will be required. So what I'm going to now focus on in the next 30 minutes or so is to actually ask each and every one of you on what is your outlook with regards to COVID-19, and with Dr. Maxwell in Ghana. What I really would like to know is that what is the Pharma Access Foundation doing about the COVID-19 and also with the supply chain challenges that we will have next year in a country like Ghana, because we all know that Africa lags behind in the infrastructure of cold storage facilities. We lag behind when it comes to the transportation systems, both for the transportation of the COVID vaccine and the last mile delivery. And what I really would like to know is what are the experiences, Dr. Maxwell, that you can actually share with us on some of the initiatives that the Pharma Access Foundation is doing in Ghana to meet this challenge, and how are you helping the government of Ghana and its Ministry of Health in getting ready for the vaccine rollout?
Well, thank you, Chair. So Africa needs 1.5 billion doses of vaccines. Now, the good news is that 1.3 billion people in Africa are transacting digitally as we speak.
Mhm.
So it provides a platform where we can reach more by doing less. So with all the bad news that we have heard about COVID, let's also admit that COVID has brought in some major structural changes to the way we operate, especially in Africa, and has somehow swept all of us, most of us, into the digital space. So current data from Financial Times shows that 80% of Africa's spending is still on essential goods, mainly health, food, and energy. And that COVID-induced digital innovations for supply chains are really taking off on the ground. So this provides an avenue where, by connecting to existing digital platforms, we could actually reach most Africans through the mobile phone. So the discussions that are ongoing now is how can we use the power of reach of mobile phone in sub-Saharan Africa to be an enabler to access to the vaccines. That's a discussion that is ongoing now. Let's also keep in mind that COVID has also enabled a major boost to the emergence of e-commerce with profound impact on digital transactions in frontier markets like Africa. And the private sector is playing a very key role in there. How can we use that opportunity to have a public-private arrangement for access to vaccines, so that unlike the traditional vaccinations where it's mainly public sector driven, already the private sector has built tremendous inflow and contact digitally with people in Africa. How can that be an enabler so that through a public-private arrangement, we can actually reach all the 1.3 billion people in Africa who are currently, as we discussed on this conference, are transacting digitally? So that's the bigger discussion that is ongoing. We may not need to reinvent the wheel. We may need to do a bit more coordination. So I like the point that Judith, Karishma, and Clement made about the multi-level assessment, multi-product assessment. How can we bring all of us on board to see how we can use existing structures, coordinate them better, using the mature model or any other model we would want to use, so that we can really get ourselves ready for this. The other good news is that COVID has also forced countries and regional groupings to explore internal capacities for developing supply chains for medicines already. So when there was global shutdown, all of us had to look inward to say, how can we get face masks? How can we get sanitizers? How can we get PPEs? And suddenly the ingenuity of sub-Saharan Africa in terms of innovation and entrepreneurship was ripped up. So these are already existing structures and systems, and adding another commodity as a COVID vaccine will not take too much to integrate as well. So the discussion now globally and also in Ghana is how can we use existing structures and the inducement, the positive inducement we have had from COVID to build a strong public-private arrangement which can make sure that COVID vaccines are made ready and they are made accessible, especially in tracking it, because we know that COVID vaccination will not be once in a lifetime event. So people will need to be followed up. And how can, if a mobile telco company is able to follow up its subscribers, how can we use the same approach and maybe the same platform, maybe add it on as a service to be able to track and monitor COVID vaccination? So those are the big discussions that are ongoing at the global level, the WHO, and many other partners, but also at the country level, the government of Ghana looking at how existing structures can be leveraged to make ready the distribution and the actual operations of administering vaccines, monitoring, collating feedback, making sure that if there are any adverse reactions, people are able to have a quick means of reporting that, and what would be a quicker means of reporting than using a mobile phone rather than walking to a hospital. So how can we use all these structures that are in place to make sure that not only the procurement of the vaccines by the government, but also the distribution, the monitoring, the administration, the operations, and also the feedback that we need from recipients are coordinated using existing structures. So that's for us, that's one of the gifts that COVID has provided for the world if we are able to make very good use of it.
Thank you, Dr. Maxwell. I really like what you talked about, which is to use our existing structures in this fight against the COVID. And the most important thing is the power of the mobile phone, because what you rightfully have mentioned is that one thing which is in common that we have with all of us is the fact that each of us has a mobile phone. And what a better way to use a mobile phone in actually making sure that some of the challenges that we are experiencing can be met just by the use of a very simple mobile phone. So I'm really, really happy with what you've said, and I'm sure this is something that can be applied to many, many countries in Africa. Now I'd like to turn my attention to Dr. Karishma. And what I would like to find out, Dr. Karishma, is that how has COVID-19 exposed Africa's vulnerabilities in the pharmaceutical industry? Now we've heard from Dr. Maxwell about the Ghana, but when you look at Africa as a whole, and when you look at some of the examples that you gave us previously on India, what is it that we can be able to adapt when it comes to the COVID-19 specifically in Africa?
Great. Thank you, Sanjeev. I actually quite liked Dr. Maxwell's point around repurposing of the production lines. And we actually have, examples of that happening on the African continent as well. For instance, there are textile and garments firms in Kenya who, repurpose their production lines for production of masks. You had automotive firms looking at production of ventilators and also exploring, 3D printing. So I think there are some excellent examples emerging, not only from Africa, but all over the world on, repurposing manufacturing production to cope with some of the challenges that COVID-19 is creating. And I think particularly for African countries, as I mentioned before, the supply side dimension is quite key, which has been exposed during the pandemic. And, estimates suggest that less than 30% of the production of pharmaceutical in Africa, is actually local. And as what that means is that African countries are not just impacted by the sort of containment measures imposed within Africa, but also in global partners such as India and China. So, for instance, you have lower access to medicine supplies as the manufacturing operations closed in India and China. You had Nigeria reporting shortages in medicines as a result of prolonged factory closures in China. You had rising prices of API ingredients. They rose from about, I think, 20 to 30% in India because of other factors such as rising air freight costs because of the hit of the aviation industry. And I'm sure, Sanjeev, you might be able to speak more to that, but these are all the challenges that we've been seeing. And on top of that, you also had countries putting in place bans on, export bans on medicinal products and pharmaceutical products. And I think, there was some 80% of restrictions being, imposed in some form or the other on pharmaceutical products. So, clearly, I think, leveraging the domestic capabilities in the African continent, has emerged as, a very, very important pathway for building resilience. And I think, Africa, particularly now, is very uniquely positioned with the African Continental Free Trade Agreement negotiations, being carried on. And I think, this is a very, very important time to sort of leverage that, leverage the economies of scale that the AFCFTA provides. In boosting domestic capabilities and pooled procurement of medicine and vaccine, and accelerating plans such as the African pharmaceutical manufacturing plan for prioritizing investment in regulatory capacity development, and also harmonization of pharmaceutical products across these countries. And I think particularly on digitalization, I think it's all about getting the incentives right. So, getting in place the right tax incentives for boosting R&D, improving affordability and accessibility of digital connectivity, digital platforms, reducing the cost of capital for automation and robotics, so that the African pharmaceutical manufacturing firms actually find it both technically and economically feasible to adopt these technologies within their plans. Investment in skills development to ensure that the African pharmaceutical workforce is equipped with the relevant digital skills. And also more broadly, you have digital solutions playing a very important role in trade facilitation on the continent. So, once you develop the domestic capabilities, how do African countries trade in pharmaceutical products with each other when they have significant non-tariff barriers, right? Like, so custom procedures, for instance, as you mentioned, and physical barriers and road infrastructure and so on. So I think, leveraging digital solutions more broadly in improving trade facilitation and boosting intra-regional trade across the continent is also quite important. So I think overall, there are excellent opportunities to be utilized through digitalization to upgrade in these value chains, whether it's, by entering into new functions or by entering into new products within the pharmaceutical industry. And I think the AFCFTA, uniquely provides an opportunity to these countries. But the key, I think, there also is that the different protocols need to sort of work together. So you have the trade and investment protocol on pharmaceutical products, but that really needs to speak to other protocols, such as the e-commerce protocols, to ensure that customers are actually able to access and leverage these digital platforms to get medicines and to get vaccines. So I think, as Maxwell mentioned, it's also about improving, I think, the coordination, so that there's, and to reducing, the systemic failures. So I think that's also quite key for effective, rollout of these medicines and vaccine programs.
Thank you, Dr. Karishma. And now I'd like to ask the same question to Dr. Gombo. And what I would like to ask both Dr. Gombo and Judith is that in the wake of the COVID-19 pandemic, what changes do you anticipate will be needed, which we need to adopt in the supply chain, in particular procurement, warehouse and distribution in the next 3 years? So what I would like to request Dr. Gombo is to give us his perspective from West African point of view. And then what I would like Judith to do is to give her perspective from an East African point of view, because both of you are from different regions of Africa. And I'm very keen to hear from Dr. Gombo on his view, being in Senegal, and just to give us an idea of what is it as far as the changes that we will anticipate over the next 3 years in the supply chain.
Thank you very much, Chair. And, Karshina and Maxwell have said very, very well. So we know that the best supply chain in the future will invest more in digital, and they will integrate also risk management into what I can call a synchronized planning. So that is what our next future supply chain will look like. So, and we have all to work on that way. So coming back to your question, and I'm gonna just explain first of all how what we did exactly in the country we are operating in, and finally what the changes we anticipate. So given all the challenges that's coming with COVID-19, so at AACF, for instance, we have chosen to invest more in digital delivery. It means that our commitment with the countries, with the Ministry of Health regarding training, technical assistance to improve supply chain engagement, have migrated from face-to-face approach to a digital delivery. This allows us to continue to achieve the goals and thrive during this terrific time. So, what are the changes that we anticipate that will be needed to be to be adopted in the supply chain procurement, warehouse and distribution in the next 3 hours? Just coming back to your question, we think that there are major changes that may need to be occur, such as reviewing our supplier base to ensure that there are adequate suppliers that can respond to the sharp changes in the demand. So all this is about agility. How are we going to put agility at the center of our network, at the center of our procurement process, at the center of our business, warehouse and distribution process? So we may also need to explore more area of automation, for instance, with the advance of social distancing. And I know that social distancing may be the norm for a while. We need also to see on the distribution center. Maybe the distribution center may need to be closer to an area where suppliers are needed and quite a lot more. This is what I can share for the moment about the changes we anticipate, and those changes need to be adopted in our supply chain, procurement, warehouse, and distribution. Thank you.
Thank you, Dr. Gombo. And Judith, over to you.
Yeah, actually, Clement has touched many of those things because they cut across the 3 different markets where we operate in. What I can mention is that what we have learned is that most member organizations, especially in the Association for Supply Chain Management, have a digital transformation roadmap. And this is not the same. It varies from one organization to another. So what COVID-19 actually magnified the need. It didn't change it at all. So what we know is even as we go into the second year of COVID, we need to be able to leverage on developing more efficient public-private collaborations. So because we focus a lot in the public sector, we need to be able to diffuse some learnings from the private sector into the public sector so that we can have a better resilient public health system and even better response to COVID-19. Again, we need to be able to rebalance the global supply networks with agility as a competitive advantage, just like what my colleague Clement mentioned. There's high importance in integrating risk management even as we continue planning, because just like the way COVID-19 came, we didn't even know how long it was going to stay. Now we know that it's going to stay for a while. We are looking into vaccines and everything, but we need to be able to intentionally integrate risk management as we do synchronized planning. I think Clement mentioned very well that some of the things we need is adaptation. We need to do a lot of adaptation. We're looking at a supplier base. One of the key areas we have seen that has been affected is demand. So we need to be able to have suppliers who can quickly respond to sharp changes in demand. We also need to be able to think about automation. Yeah, like you said, one of the things that we did at ASCM, even as we implemented the maturity model from version 6 all the way to version 8, we realized that we needed to leverage on digital delivery because our commitments with countries, with the Ministry of Health regarding training, technical assistance to improve supply chains was still there. So what we did, we moved from face-to-face approach to digital delivery, which allowed us to continue to achieve the goals and thrive even during this time of COVID-19. Yeah, that's what.
Thank you.
Yeah.
Thank you very much, Judith. As we are now approaching the end of our session, what I would like to do is to now reflect on the COVID-19 and what is it that we can be able to convey as a message to the delegates who are taking part in the Pharma Logistics Africa event, and what is it that we are trying to say in terms of what can be done to strengthen the supply chain. Now, we've actually heard a lot of exciting words. We've heard the words of resilience, agility, digitalization, IoT, blockchain, self-assessment tool, innovation, adaptation, mobile technology, and automation. So what I would like to now ask each and every one of you, starting with Dr. Maxwell, is your one message to the delegates with regards to what can be done to strengthen the supply chain in Africa so that we can meet the requirement of the COVID-19 vaccine rollout next year.
So, Chair, thank you. My message would be that big ideas start fragile. So don't be afraid to start small, and keep it simple. So that will be because if you look at the landscape, sometimes you can be a bit discouraged by the enormity of tasks ahead of deploying 1.5 billion doses of vaccines across villages, hamlets, and huts, and cities, and urban centers. It looks quite daunting, but if we start small and we keep it simple, using and repurposing existing structures, we can really get there.
Thank you, Dr. Maxwell. And this is one of the philosophies that I live up to, which is that it is the small steps that you need to take to complete the journey. And this is something that you've really put it very, very well. And definitely I would take some inspiration from that. And I now would like to turn my attention to Dr. Karishma.
Yeah, I think just building on that, maybe start small, but in a more targeted manner, which really leverages a coordinated and systematic approach, particularly when we talk about digital technologies, because then you're bringing in many stakeholders and partners, within the pharmaceutical supply chain. So I think targeted efforts are also quite key when we look at leveraging some of the potential of digital technologies for improving pharma manufacturing.
Thank you. Thank you. Dr. Clement Gombo.
Yeah, thank you very much, Chair. So, I'm thinking about school fishing. School fishing is, just to quote my director, Peter, is speaking about school fishing. It means that we have to go together. And this is a very, very bad time. And private and public sector need to be together so that we can fight this COVID-19 and to strengthen our supply chain. This is my last message. Going alone, it is like dying. So during this moment, private and public, all organizations have to be together fighting this time and strengthening our supply chain, be it public or private. That is my last one.
Thank you. Thank you so much. And Judith, over to you.
Thank you very much, Chair. For me, I just have one very short phrase that I like that always resonates with me. So whatever we do, even as we come up with the vaccines, we need to be able to think global, but we need to be able to act local. We need to be able to look at the contextual dynamics in the different regions. And we also need to look at, how can we take advantage of mobilizing the supply chain community? Because by mobilizing the supply chain community, we can actually create opportunities and solve critical problems affecting countless lives. So for me, it's think global, act local.
Very well said, Judith. And on my part, I would actually say collaboration, because I believe that collaboration is a very important thing that we need to do as all members of supply chain. We need to have collaboration with the manufacturers, and we need to collaborate with each and every member of the supply chain. Otherwise, it's going to be impossible to meet the task that is ahead of us. So with that, I'd like to thank all of you for your valuable contributions. And this has been a really great session, and it's been a bit serious. So I want to try and liven it up by sort of, cracking a joke. And this is something that happened yesterday, that when I was I was in the supermarket, and the person standing in front of me passed a gas. So before I could say anything, he turned around and he said, "If you heard a sound, it means you aren't following social distancing." And then he went ahead and said that if you got a bad smell, it means that you're not wearing your mask properly. And then the last thing he said is that if that smell is intense, you are lucky because you are corona negative. So with that, I'd like to thank each and every one of you. It's been a great learning and sharing with all of you. And I will now hand us over back to our fantastic organizer, Noor. Noor, are you still there with us?